The World Health Organization says an estimated 2.2 billion cases of malaria and 12.7 million deaths have been averted since the year 2000. In a new report, the organization says malaria remains a serious global health threat, especially in Africa. Let's unpack this further. We're joined by Professor Tafadzwanashe Mabhaudhi. He's a professor of climate change and food systems with the London School of Hygiene and Tropical Medicine. Prof, it's great to have you with us on the show. You're not joining us from London, I see, this afternoon, but nonetheless, welcome. And your title, which is a professor of climate change, is a good way to segue into my first question. How much of the increase that this report talks about, the increase in malaria cases from 2022 to 2023, has to do with climate change?
Thank you and good afternoon. So the report does not really discern or attribute how much of the increase is due to climate change. But the report, for the first time, this report does include a dedicated chapter looking at the intersection between climate change and malaria. The increase in the latest report is mostly because of COVID-19 and the end to COVID-19 travel restrictions. So during the COVID-19 period and lockdowns, we saw malaria rates of infection and transmission going down, mostly because people were at home and there wasn't much movement. Post-COVID, there's been an upsurge in malaria cases, but also we note that post-COVID, there's been an upsurge in extreme weather events, notably floods, which then create conditions that are conducive for the spread of malaria.
You know, you talk about COVID-19 as one reason why infections at one stage were going down, but is it also a reason for the almost 600,000 malaria deaths we've seen worldwide in 2023? And the reason why I'm asking you this is because we know that governments took so much of their health budgets during COVID-19, during the pandemic, to try to acquire vaccines. I wonder whether that would have had an impact on other treatments for other diseases, including malaria.
So I can say certainly for South Africa, that would not be the case. South Africa has really made good progress in that regard, and funding for malaria has been pretty much steady and stable. In terms of, yes, there are constraints in that it has not increased at the pace at which it should increase, but there hasn't been any movement in that case. The declines during COVID-19 were mostly because of the lockdowns, people not moving, so the rates of transmission and so forth went down during that period, as we saw in many other instances during COVID-19 lockdowns. And then post-COVID-19, with the economy starting to get back into place, people moving around a lot again, we've seen rates of malaria infection also going up. And yes, broadly in sub-Saharan Africa, the malaria response did suffer, not just in terms of the local response, but also in terms of the global attention given to the disease, as most global attention and efforts shifted to COVID-19. And there was less focus on malaria during that period. So it's a combination of factors. Yeah. But in South Africa, it could be a different scenario.
Yeah. I see that the report says there is a scale-up of vaccines across the African continent. It's expected to save tens of thousands of young lives every year. But there is still inadequate funding for malaria in most African countries. The report tells us last year total funding reached an estimated $4 billion US, and the funding target for that year was over $8 billion. So we got under half, less than half of the funding that we needed to properly tackle malaria.
Indeed, so that's a more correct analysis in terms of the gap in funding requirement, especially in Africa more broadly, where a lot of governments actually do depend to a very large extent on this donor aid and financing to be able to fund malaria prevention, detection, and treatment schemes, and also just to fund their health infrastructure and healthcare systems. So there's been a decline in funding, actually, because of the global economy not doing very well post-COVID. And that has implications on malaria as a disease and malaria as a threat to to Africa's development as a whole.
Yeah.
And of course, climate change is also having an effect in this whole instance in terms of it increasing the range of mosquitoes, how far they can go, shortening their incubation periods, and increasing rates of transmission.
Yeah, absolutely. I want to talk more about the deaths for 2023, almost 600,000 people. We've already talked about the funding gaps, Prof. But there are other gaps when we talk particularly about the African continent and particular parts of the world. There are other gaps in the treatment of various diseases, such as a fragile or sometimes non-existent health system.
So that is indeed a major gap, as I indicated that in much of Africa, even in South Africa, access to healthcare, access to universal healthcare is still very much problematic. We've got large populations that are still residing in rural areas with lack of access to healthcare, lack of access to proper wash, water, sanitation, and hygiene. And this creates environments or places that are conducive for the spread of malaria, contaminated water bodies, and inequality and poverty still much is on the increase in Africa and has worsened, especially since COVID-19. So this puts a greater part of the population at risk and vulnerable to malaria. And then with inadequate healthcare, it means that the access to prevention, detection, and treatment is then limited. So malaria continues to be a problem. It continues to increase. And as you are saying and noting rightly, that the number of deaths is still unacceptably high in Africa.
Yeah, and it's an indictment, isn't it, that the most vulnerable communities, as it is, if we take malaria out of the equation completely, but the most vulnerable communities, pregnant women, girls, children under the age of 5, indigenous peoples, migrants, persons with disabilities, ironically, they are the worst affected by this issue of us not being able to properly, in the way that we really want and need, address malaria on the African continent.
Indeed. So the vulnerable people are always disproportionately affected and also disproportionately exposed to a lot of vagaries. And by the fact of them being vulnerable, it means they lack the means to assist themselves. Women, children often cannot assist themselves. They need an adult to assist them. The elderly, the disabled people, and the distances that people in some areas have to travel to access proper healthcare also worsens this situation. So, but broadly in Africa, there is that intersectionality of health and poverty and inequality, which we need to address as a separate issue in terms of improving access or equitable access to healthcare services and facilities.
Certainly. And as the WHO says, we've made some strides, but malaria remains a global health threat, particularly in the African region. Professor Tafadzwanashe Mabhaudhi, thank you for your time this afternoon. He's a professor of climate change, food systems and health with the London School of Hygiene and Tropical Medicine.